Prior to the assessment, vital signs, height, and weight were obtained. Andrew is a 25-year-old white male with well-nourished and appears to be his stated age. His hair, nails, and skin all appear to be well kept. He ambulates with appropriate gait and posture. His speech is clear, and he is present and cooperative and does not appear to be in any signs of distress. We're going to start with an assessment of the skin, which appears to be pink. It is warm, dry, smooth, and symmetric. He has elastic skin turgor. I'm going to move on to his nails, which are smooth and pink with a capillary refill of less than 3 seconds. They are kept short and they do not have any ridging or irregularities, and they appear to be of normal thickness. His angle base, you can go like this, is 160 degrees. His hair is coarse, brown, and thick with normal distribution. It doesn't appear to have any sort of infestations, and his scalp doesn't appear to have any inflammation or irritation. Do you have any tenderness of your scalp?
No.
Okay, good. His head is round and appropriate size and symmetric. If you could just do what I do, could you smile and frown? Show your teeth, puff out your cheeks, raise your eyebrows, and try to keep your eyes closed while I attempt to open them. Very good. Cranial nerve 7 is intact. From there, I'm going to go ahead and palpate your sinuses. If you could just tell me if you have any tenderness. We'll start with the maxillary.
No.
Okay. And the frontal.
No.
Good. The next thing we're going to assess is a touch sensation. If you could just tell me if you feel a sharp or dull touch. If I could see your hand. This is sharp and this is dull. You could just close your eyes. Good. Tell me what you feel.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Good job. And that's assessing cranial nerve 5. If you could just clench your teeth, I'll palpate your masseter muscles, and that's also assessing cranial nerve 5, which is intact. From here, we are going to go on to assess cranial nerve 11. If you could just turn your head against my hands. Good. And the other side. Good. And lift your shoulders and don't let me push them down. Good. Cranial nerve 11 is intact. Your neck appears to be symmetric without any masses or scars. Your trachea is midline. I'm going to go ahead and palpate your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, superior cervical, deep cervical. And if you could just shrug your shoulders, superior, supraclavicular, and infraclavicular. Okay? Next, we're going to check the range of motion of your neck. If you could just do what I do. This is flexion, neutral extension, hyperextension, lateral bending, and rotation. Very good. From here, we're going to go ahead and assess the thyroid. I'm going to have you take a drink of water while I palpate the right and then the left thyroid. Go ahead whenever you're ready. Okay, take one more drink. Good. And then I'm going to go ahead and palpate your carotid on the right side and on the left side. Okay. And then I'm going to look at the anterior and posterior angle, which appear to be symmetric on both sides. We're going to move on to your eyes. Your eyes appear to be equal without any drooping of the eyelids. Your eyes are symmetric. Your eyelashes are evenly distributed and dark in color. Your sclera is white and your conjunctiva is pink, and both are without any erythema. From here, I'm going to go on to check cranial nerves 3, 4, and 6. We're going to start with the cover-uncover test. You could just look straight ahead. Okay, one more time. Good. And then if you could follow my finger. Good. Cranial nerves 3, 4, and 6 are intact along with the extraocular movements, and there are no signs of nystagmus. Next, we will go ahead and check your pupils. If you just look straight ahead, I'm going to shine a bright light in your eyes. Okay. And again on the other side. Good. Pupils are equal, round, reactive to light accommodation. I'm going to go ahead and assess the lacrimal gland. And it appears to be without any excessive tearing or any dryness. From here, we will look at the orbits, which yours appear to be without edema or drainage or sagging or any sort of lesion. Your cornea is clear without any opacities, and your iris is brown without any bulging. And the next thing I'm going to do is the ophthalmic exam. Okay. The lens is clear, the red reflex is present, the retina, arteries, and veins are able to visualize. There are no lesions present. The optic disc has clear margins. The physiologic cup is white and yellow, and half that of the disc. And the macula is white with an avascular area. From here, we would go ahead and use the Snellen chart to test vision, and we would also check cranial nerve 2. If you could just go ahead and cover your left eye with your hand and tell me when you can see my finger.
Okay. 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 Okay.
Cranial nerve 2 is intact, and we would do that with both eyes. We will go ahead and move on to the ears. His external ears appear to be symmetric and in line with his eyes. They are pink in color and set at 10 degrees, and they do not appear to have any exudate and appear to be clean. I'm going to go ahead and palpate them. If you could just tell me if you have any tenderness.
No.
Here?
No.
And back here?
No.
Okay, good. From here, I'm going to go ahead and look in the ear. And I can see the tympanic membrane, the cone of light, the umbo, the short process of malleus, and the handle of malleus. And I would check that in both ears. We are going to go ahead and do the Weber test. If you could just tell me if you can hear this equally on both sides.
Yes.
Okay. And the Rhine test, I'll put it on the bone behind your ear, and you can tell me when you can't hear it anymore, and then beside your ear, and you can tell me when you can't hear that anymore.
Okay.
Okay. And air conduction is twice that of bone conduction. And then we're going to go ahead and do the whisper test. I'm going to cover one ear, and if you can just tell me what you hear.
99.
Good. And one more time.
11.
Good. And all three of those tests are testing cranial nerve 8, which is intact. We're going to move on to the nose. His external nose is symmetric without any sort of deviation, without any masses, drainage, bleeding, or foreign objects. I'm going to check the patency. If you could just take a breath in. Good. And another breath in. Good. His nasal passages are patent. And we're going to go ahead and test cranial nerve 1. If you could close your eyes and then just tell me what you smell.
Coffee.
Good. And keep your eyes closed. And again.
Vanilla.
Good.
Vanilla.
Cranial nerve 1 is intact. I'm going to go ahead and take a look inside the nose. His internal mucosa is pink and intact and moist. There's no deviation of the septum. I can see his inferior and medial turbinates, which are without inflammation or lesions of any kind. Okay, we're going to move on to the mouth. His lips appear pink, moist, and clean. And if you could just go ahead and open up your mouth, I'm going to take a quick look inside. I'm going to use this to hold your tongue down. His mouth is pink and moist and clean without any apparent lesions. His gums are pink. His uvula is pink. His pharynx is pink. Can you say ah?
Ah.
And the uvula rises in the midline, which means that cranial nerve 10 is intact. And his frenulum is also, if you could just lift your tongue up, his frenulum is also in the midline. Can you move your stick your tongue out and move it side to side? Side to side, good. And push against my hand. Good. That means that cranial nerve 12 is intact. We would also do cranial nerve 9 to check the gag reflex, which I'm not going to do to you right now. And then I'm going to check your dentation. So you can open up. Your teeth are white, clean, evenly distributed, and without any dental caries that I can notice. All right, all done.